And we welcome you back to Talk of the Town for this Monday, December 14th. I'm Gary Stevens. We'll be open line following the 11 o'clock news. But on the second Monday of the month, we spend some time talking about things going on in Lansing with one of the representatives who represent the Lakeshore in the State House in Lansing. She is Mary Whiteford from the South Haven area. Most of her district is in Allegan County. She joins us via the Zoom connection. Mary, good morning and welcome back to WHTC.
Good morning, Gary. Good morning, everybody.
Glad you are with us. And if you have a question for Mary, she'll be happy to take it at 395-1450, 395-1450. Let's go first to the story of this particular day in Lansing. Right now, the Capitol, the House and Senate buildings are closed. Abundance of caution ahead of the 2 o'clock Electoral College vote on the floor of the Senate. Your thoughts on the fact that right now, as Mike Shirkey has said, the Senate Majority Leader, the People's House right now is closed to the people.
Right. So we've had conversations with Michigan State Police and the Capitol officers and found out that there were some credible threats to the safety of individuals in the entire Capitol complex. So it was advised that absolutely no staff can come in today. Legislators can go. I choose not to. I try to stay out of the drama as much as I can. And then the electoral proceedings happen at 1. Besides that, I don't know anything else. I'm just trying to pay attention to things. But, you know, I think the biggest news of the day is the first people in Michigan are getting vaccinations against COVID. So a historical day on many fronts. But I just got off a call with the Department of Health and Human Services and getting information about that. These vaccinations are going to be in every public health department by the end of next week, so that the people who are most at risk, the level 1 individuals, can start getting their vaccines. Level 1 meaning the people who provide direct care to people. Let's see, I've got it right here. I want to make sure I was ready. Phase 1 includes paid and unpaid persons serving in healthcare settings who have direct or indirect exposure to patients or infectious materials and are unable to work from home, as well as residents of long-term facilities. After that, then some workers in essential critical industries, including workers with unique skill sets, such as non-hospital or public health laboratories or mortuary services. And then the third part of phase 1 is people at high risk for severe COVID-19 illness. So that's huge. I think with this news coming out, it gives so much more hope that not only do we have some therapeutics for people when they get sick, because we've had over 6 months of experience with this illness, but now we're able to start preventing illness throughout our high risk, meeting people who are sick industries. And so that's what I really want to focus on today.
Let's go along those lines of this tier system of getting the vaccine. The only complaint I have, and maybe it's a personal one on my part, is the fact that my 94-year-old mother is living on her own. She is not in an assisted living or a nursing home situation, yet it looks as if she's not first in line in this particular situation.
Well, surprisingly, it's a real rapid track of people qualifying for vaccines. The general public will qualify within 3 months. And so I'm looking at the phases that they gave us. It looks like only a couple of weeks through each phase, and your mother will be able to get her vaccine fairly quickly. So I'll be sure and give weekly updates to everybody on my state rep page so that you can be aware of when you're getting it. But I'm sure Holland Sentinel and WHTC, everybody's going to be keeping our public aware of this. And I'm pro-vaccine. Smartly. So I worked in an emergency room with kids. I saw every single one of these illnesses that children are vaccinated against. And I saw how sick they are. But I think you have to be smart about it as well. Something that I wrote into my budget bill was that the department needs to be more transparent about what vaccines that they are recommending to our doctors for our kids. You know, what are these vaccines? What's the rationale? And so people have a more informed choice going through vaccines, but that's one side of it. But me, I mean, I get my flu shot I think this is something, I don't want to get sick. I don't want to get my mom sick. She is very, very sensitive to vaccinations themselves. So that's between her and her doctor if she should be getting the COVID vaccine. But for me, I'm going to get it as soon as I can.
395-1450. Good morning. You're on the line with State Representative Mary Whiteford.
Yeah, you think Trump, the other guy that became president, is going to hand out stimulus checks, and are you fighting for America to get them? Thank you.
I appreciate the call. 395-1450, 395-1450. One thing that my mom, when I talked to her yesterday, and I tried to, sort of assure her about the safety, but she says, I'm scared. I don't know everything about this vaccine. Is that justifiable apprehension? People are just not certain of it, so they're going to say not yet?
Well, there's always going to be a level of uncertainty. One nice thing that the department was just telling me, I got off the call 10 minutes before I came on here, is that when somebody gets the vaccine, they're going to have the ability to respond daily if they have any symptoms at all. You know, does your arm hurt? Are you getting a fever? Anything at all? And they're going to be able to text back and forth and stay on top of this data. Everything's going to be coming in really, really rapid fire fast. And we should have, thus far, it wouldn't be available publicly unless it went through the proper trials, which were done. So for her, I mean, it's between her and her doctor, and with you, her son, being involved, I always think that's always the final determination for a decision for somebody.
Unfortunately, I'm the youngest in the family, and usually my older brother and my older sister, they listen to them. It's the old youngest doesn't know anything about it. Of course, some of our listeners says, his older brother and his older sister know a little something about him. So yeah, we don't listen to him either. But anyway, that's an entirely different story.
Our families. But I think it is really important, though, for everybody to realize it's up to you. And I will never support a mandate of a vaccine like this, but have a conversation with your doctor, do the right thing for yourself, and time will tell. I mean, when flu shots first came out, I was a little wary too, and then I realized I wasn't catching it after I had it like 15 years ago. So it's your choice, and that's really important.
395-1450, 395-1450. If you have a question for State Representative Mary Whiteford, who represents Allegan County in the State House. House was off last week in terms of no sessions. Your thoughts on that, and the fact that the OSHA says that there's a complaint that the House wasn't following COVID-19 guidelines, and maybe that was part of the reason why it was closed up?
That's an argument that goes back and forth. Frequently, people from the other side of the aisle are complaining that Republicans aren't wearing their mask. I wear mine when I'm going back and forth and around, but when I'm just sitting there, I have trouble breathing. I'm a little prone to asthma. So when I'm in a space where I know that I'm, I've got my 6 feet and everything, I'll take it off just to get a fresh breath of air. But there's some Democrats out on the floor who don't wear their mask as well. So it's kind of, it's a little more political than you think. We don't have a mask mandate in our state. I won't support it. Come on. How can we have a law that makes 10 million people, just shy of 10 million people, be forced to wear a mask in certain situations, and then you have to put it on law enforcement to enforce it? Because if you have a law, you have to enforce it. So that's why I recommend it. I recommend universal precautions, like when I started nursing 35 years ago, when we first started having babies showing up with HIV. We had this term, it was called universal precautions. We don't talk about it as much, but I think that's important for everybody. Wash your hands. If you're sick, stay home. We don't see these sick little kiddos going to school anymore because they get their fever checked beforehand. We're much more strict about addressing the fact when you're sick, stay home. Wash your hands, keep a safe distance, wear your mask when you're around other people. I went Christmas shopping yesterday, and I had my mask around my neck and I pulled it up whenever I was in public. When I got in my car, I didn't have it on. Just things like that I chose to do. But I also know there's a lot of people who have medical problems or psychiatric problems. Wearing that mask is very, very difficult for them. So I had a teletown hall last week. I had almost 2,000 people on there. And one woman was complaining about individuals at the stores and stuff not wearing a mask. And she knows that they're healthy because she looked at them. And so I just tried to have her segue into the thought that, you can control your actions. You can keep yourself safe. If somebody isn't wearing a mask and you're nervous about it, don't confront them. Just stay away. Give yourself 20 feet if you need to. We all have different things going on in our lives. And it's very, very hard emotionally on so many of us because we are going around wearing a mask. We don't have those facial indicators that smile. West Michigan's known for our kindness, and we can't see it as easily when you're wearing a mask. So just kind of be kind, keep yourself safe, have your own universal precautions, keep your family safe. And now soon enough, we'll have an option to have a vaccine as well.
395-1450 if you have a question for State Representative Mary Whiteford. Let's talk a little bit about some work that needs to be done or it may be addressed by the legislature when you do go back to work this week. The governor wants $150 million to help sort of a state stimulus package because nothing has come from Washington yet. Can that be done, or because the budget constraints are as is, she may be asking for something that can't be done unless you raise taxes?
There's a lot of constraints. And then when you put that kind of money out, how are you going to pick and choose who gets it? The people who are having the most difficulty right now are restaurants and people who work in restaurants, movie theaters. I don't know how the one theater down on 8th Street is surviving. So I have a concern with that, and the fact that we may have additional funds right now, but we have to make sure that we're covered going into next year. I'm not sure when the economy is going to truly bounce back. We have some good indicators, but for me, in the short term, I'm not sure exactly what my appropriations chair, what kind of conversations that he is having with the governor's office, but I would prefer to address this come January instead of just having a rash decision. I also know from our congressman that a package is coming. I think I heard Congressman Heisinger say there's like tens of millions of unused CARES money that the states that are sitting on the table that they can push out into a second stimulus package. So I know there's a lot of conversations going on with the federal money. My one request was to have the legislature a little bit more involved. I was concerned when a month ago I saw a report of how our CARES money was spent, and that $41 million was spent on a flu vaccine campaign. That's a lot of money for a campaign. And, it's getting the things up on the boards and billboards and radio and TV, but there's a lot of people in the media making a lot of money too off of that money. So I want to make sure that the money actually goes to help people and our frontline workers. I've been listening to people who take care of developmentally disabled individuals in our community, and they didn't get any support with getting PPE funds. So they have a request out there for $2.25 million to make sure throughout our entire state that these direct care workers are getting support to keep themselves and their clients safe. So that's my one request from Congressman Upton and Heisinger, is that the legislature has a little more buy-in with the determination of where funds go, because together we can do it best.
395-1450. Good morning. You're on the line with State Representative Mary Whiteford.
Good morning. I don't know if you have an answer for this, but, last week in the Sentinel, I read an article about how Michigan was the number 4th state in the country having the amount of sex offenders. It's really strange in that they also said in the article something about Allegan and Ottawa County having a lot of them. And, I have noticed in the police log a lot of addresses, not the home phone address, but the street address. And, they say Ottawa County has grown so much population. Now, how come we become known as the number 4 sex offender state? I'll hang up, and I don't know if you can answer this, but just wondering. Thank you.
Appreciate the call. 395-1450, Mary.
Yeah, honestly, I have no idea. The data gets out there, we can set up laws. I know we're currently redoing some of the sex offender laws because of a Supreme Court decision that certain individuals have got their records on forever, others don't, and trying to have some consistency across the state. So I'm sorry, I don't have a better answer. I don't know what happens behind closed doors oftentimes, and if people are caught and prosecuted and put on these registries. So, wish I had more information, sorry.
Mary, I do want to bring up, and I want to get it queued up here on my, while I do that, I will take a call, and we say, good morning, you're on the line with State Representative Mary Whiteford.
Good morning. I would like to ask her, why do we need a stimulus for restaurants and that when all the governor has to do is open them up? And another thing is, how can she use the health department all the time for her agenda? And if you can go to the casino to gamble and sit with people and everything, why can't I go to a restaurant and have coffee with a friend? Thank you.
I appreciate the call, Mary.
Yep, I agree with you. She's able to go through the public health code to do this, but this has been challenged. We have some bills introduced. I think it passed out of the Senate last week, just to put a little more checks and balances on those decisions, because I am really, really concerned about our restaurants. And, you know, it's sad. You walk through these towns and you can't go in and get something to eat. You can grab food and sit in your car or sit outside, but it's cold. There's pop-up tents. Are they any safer than indoor seating? There's a lot of concerns I have. So thanks for sharing your perspective. It's frustrating. I mean, I was Christmas shopping yesterday, of course, and my husband and I grabbed some food and sat in the truck and, and ate it. I would have much rather eaten inside and thrown my garbage out and not spilt on myself. And so thanks for sharing those thoughts, especially during this Christmas time when everybody's trying to get out.
The thing about the casinos, I just want to remind people, outside of the 3 casinos in Detroit, all the other casinos are Indian-run casinos on sovereign land. That's federal. That's a federal law. So if they want to open, they want to cooperate with the state, fine, but that's their own property. And then, you know, there's a difference between that and what the state can do.
So you bring up a good point, and plus I mentioned it earlier, is the sadness, the fear, so a lot of mental health issues going on right now. Throughout these past couple of years, I've talked about the Michigan Crisis and Access Line that got signed into law. So I did get word that it is being implemented in a small area within the next few months, and then expanding statewide. So it'll be the MICAL, Michigan Integrated Crisis and Access Line. Anybody can call and get a referral locally, get an appointment set up, or if you're in a crisis, get you the help you need right there and then. So I'm pretty excited about that. That we'll have this, and it'll be the only one in the entire country that you can anybody can call. So it's a warm line as well, warm line, where you call and you'll talk to a trained professional to help you through a situation and get you follow-up care.
I was going to bring that up, Mary. I'm glad you did, because I was trying to cue that up when the last caller came on board. But that's certainly something that's a passion of yours and maybe a legacy as you are heading into your final 2-year term beginning next year. And so, you know, just as other state representatives and senators have left legacies of things they wanted to do and it's been followed up, certainly mental health is something that's right up your particular alley. Yeah, what do you want to see from, last question, what do you want to see from 2021 besides getting us out of this COVID-19 nightmare? What would you like to see in 2021 from the state legislature and from the state government over the next 12 months?
You know, I want to see a recovery. I want us to see us spending money properly. I plan on continuing chairing half the state budget, Health and Human Services. I want to make sure that we're really laser focused, that money follows people, the people that are most in need, the most vulnerable of our state. I want to see proper financing and payment to doctors and healthcare professionals, direct care workers, the people who go into the homes to help our developmentally disabled friends while they're there. I'm really laser focused on that. That's going to be the biggest carry that I have is me personally, is to make sure money follows the people who need it most. Overall, though, I think we've learned a lot of things from telehealth to homeschooling. We've thought outside the box in so many ways and realized there's a lot of different ways that we can have our healthcare, a lot of different ways to educate our children, and we need to make sure that we're doing the right thing for those kids and the people of our state.
State Representative Mary Whiteford, thank you very much for joining us today on WHTC. Wish you and your family not only a safe and blessed Christmas, but a good new year. And we look forward to chatting with you again in the month of January.
Thank you, Gary. God bless everybody. Merry Christmas.
Thank you very much, State Representative Mary Whiteford on 99.7 and 1450 WHTC. CBS News is next on the hour.